Now to Canada, which became one of the first countries to administer the COVID-19 vaccine on Monday. 5 frontline workers in Ontario were among the first Canadians to receive the vaccine at one of Toronto's hospitals. This comes as Ontario is ordering hospitals to get ready for a surge of patients. Non-essential businesses, including malls and restaurants, have been ordered to close in the York region by the Ontario government as cases spike. The province reported more than 2,000 cases yesterday for a second day in a row. Joining us now, Deputy Premier and Minister of Health of Ontario, Canada, the Honourable Christine Elliott. Thank you so much for being on. We'd love to know how things are going in Canada pertaining to the virus, Ontario specifically, compared to the U.S. You all are expecting a surge. How do the numbers look compared to ours?
Well, the numbers we've been able to manage pretty well up until now. In fact, Ontario right now has the lowest number of cases per 100,000 of any jurisdiction in North America, except for our Atlantic provinces, which are sort of in a bubble right now. But we are experiencing a surge in cases right now. It's putting our hospitals to the limits, but we're managing. As with everybody else, we're going through a surge, and Ontario is no different.
And what do you attribute the surge to? Is it the Thanksgiving holiday? And also, what do you attribute your relatively lower numbers to?
Well, I think the surge is, we're just seeing it everywhere. I think it's community transmission, and there's a certain amount of COVID fatigue that set in, that people are feeling in some ways that because there's a vaccine on the horizon, that they don't need to practice the same public health measures that we've been advising since the beginning of the pandemic. But we're really urging people to continue to follow those measures, because even though there is a vaccine available now, it's going to take some months before everyone in Ontario who wants to receive a vaccine will receive one. So we're encouraging people to follow the rules.
Sorry, I didn't mean to interrupt you there. I was curious to know, just because we're going through it here in the United States, obviously on a case-by-case, city-by-city, state-by-state basis, what Toronto, for example, has done in terms of shutdowns. How restrictive has it been in schools? How restrictive has it been with restaurants?
Well, it's been really important for us to keep our schools open, because we know that's really important for young people, both for their physical health and their mental health, to keep them in school and learning. But we also have different regions that we have set up according to different public health guidelines. You can move from green as the lowest level, which is the safest level, all the way up to a lockdown. So we have some areas that are in lockdown right now, including Toronto, where stores are closed, restaurants are closed. We're encouraging people not to move around too much. It's the toughest for people, especially at the holiday season, but it's really important to help us to limit that community transmission, so that our hospitals are going to be able to cope, and that people are going to be able to move around safely.
Well, we really appreciate the leadership on this. I'm sure it's helpful in mitigating the spread of the virus. Ontario's Deputy Premier and Minister of Health, the Honourable Christine Elliott. Thank you so much for being on the show this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.